one can look at a painting and see it in many different ways. However, I think the facts, as it relates to the Affordable Care Act, is beyond the beauty in the eye of the beholder. For me, I see it extending coverage to more than 16 million Americans. Many Hispanic Americans who see them on the largest increase in insurance coverage when it was one of the largest groups that was uninsured. It now guarantees that nearly 130 million Americans can no longer be denied coverage because of a pre-existing condition, which prior to the Affordable Care Act meant insurance companies could deny coverage to a woman who had a C-section or a child with allergies. It sharply reduced the cost of prescription medications under Part D, saving seniors $11.5 billion while keeping premiums flat. And it's improved the quality of coverage so that when an unfortunate diagnosis occurs, families will know that their insurance has the coverage they need and that they can't be dropped from coverage entirely because they need care. So I look at some of the statements that have been made, and I guess, again, there's a different way to look at it. I hear the question of, well, higher deductibles. Dr. Blumenthal, isn't it true that there is no annual or lifetime limits and new annual out-of-pocket limits? As I understand it, beginning in 2014, the law banned annual limits on coverage in new health care plans, extending the protection to millions. As well as that most insurers must place a hard limit on enrollees' annual out-of-pocket spending for essential health benefits, providing protection against catastrophic costs?
You're correct. You're correct, Senator. There are now limits on the deniability of coverage, guaranteed renewability, and you can no longer set annual lifetime or set lifetime limits on benefits.
Now, the next thing I've heard consistently is more limited benefits, which I really find difficult to understand. As I understand it, the Affordable Care Act ultimately healthcare plans cover proven preventative services, which has resulted in more than 76 million Americans gaining coverage of preventative benefits with no cost sharing or deductible. Is that a fair statement?
That's correct.
And then fewer doctors. Under the health care law, for the first time, insurers are required to cover a range of doctors, specialists, and community providers and meet minimum network adequacy standards. It seems to me that that gives consumers the opportunity and the tools and information to shop for a plan that meets their needs, and it ensures families don't face higher cost sharing if they have to go to an out-of-network emergency room. Is that a fair statement?
That's correct.
Now, let me talk about what the plan has not caused, which I heard when we were passing the Affordable Care Act. It has not caused an economic catastrophe. In fact, in the last 5 years, the U.S. has seen the longest stretch in job growth ever, adding 12 million jobs, cutting the unemployment rate in half. It has not led to the creation of what some have called a part-time economy, since more than 90% of that record-breaking job creation has been full-time jobs. It has not led to massive increases in health spending or premiums, but rather it slowed the growth in health costs to the lowest level in half a century, resulted in below-predicted premiums for private market insurance plans, and led a historically low increase in employer-sponsored health premiums. And it has not, I repeat, not, and this is particularly important as we go into the budget debates we're going to have, Mr. Chairman, added to the deficit. In fact, the Congressional Budget Office has on every occasion stated that the Affordable Care Act reduces budget deficit in both the near and long term. So while my friends on the other side of the aisle might not want to recognize this fact, the budget proposal they released just yesterday admits it because it explicitly prohibits raising a budget point of order against adding to the country's long-term deficit that would be caused by repealing the Affordable Care Act. And to top things off, their budget continues to count the billions of dollars in revenue generated by the Affordable Care Act in the budget's baseline, despite having repealed the ACA and all of the policies that generate the revenue it contains. So you can't have it both ways. You can't have all the benefits under the law and account for all the revenue under the law and then say it should just be repealed. That doesn't work, and that's not even realistic, and I think the American public gets that. Thank you, Mr. Chairman, for the opportunity.